Morning Edition.
October is Breast Cancer Awareness Month, and this week is dedicated to raising awareness that men can also get the disease. FioS 1's Raven Santana spoke with a survivor who described his cancer journey.
In a sea of pink filled with thousands of survivors, thrivers, and supporters of breast cancer awareness, Mark Goldstein can't help standing out. That's because the 89-year-old is one of few men, if only in the crowd, that is a breast cancer survivor and wants other men to know that male breast cancer is rare but there. A motto he wears on a shirt that he has worn to all 234 Susan G. Komen races he has run in.
Conventional wisdom is that this is a female disease, and statistically that's quite true. So men really aren't aware that they can develop what is thought to be a woman's disease.
The Randolph, New Jersey native, husband and father of 3, was diagnosed with stage 1 breast cancer at age 55.
Well, I first was made aware that I had a growth beneath my nipple in February of 1988. But in typical male fashion, what do you think I did? Nothing. Had that been my wife, we would have been in the doctor's office the very next day.
3 months later, Goldstein did eventually visit a doctor who diagnosed his condition, breast cancer. He underwent surgery where a portion of his left breast was removed and was followed by chemotherapy and radiation. Goldstein, who has counseled more than 60 male breast cancer survivors, praises support groups for his positive thinking. He says fighting the disease as a male was lonely at times.
Yes, you are alone. More often than not, when you're in the company of a female, in this case my wife, it is my wife that they believe is the object of the breast cancer, certainly not me.
In fact, doctors say a big misconception is that men can't get breast cancer, which is why many of them never check for it.
It's very important for men to be aware of the family history on all sides of the family, both the mother and the father's side.
Unfortunately, breast cancer in men can be diagnosed later because we don't routinely screen for male breast cancer. Men should also be examining their armpits to feel for lymph nodes as well.
Goldstein is now on a mission to bring awareness to other males about breast cancer, even the most macho ones. He says those are the ones most at risk.
This is not an assault on your masculinity. Knowing that you could develop this disease should not affect you from an emotional standpoint. This is knowledge that you have just acquired. Act upon that knowledge.
Next stop for Mark Goldstein, the next Komen race in Arkansas on October 22nd. He'll be the 6'2", gray-haired 89-year-old wearing a pink visor and his trademark shirt, bringing male breast cancer awareness to other men, one race at a time. In Morristown, Raven Santana, FioS 1 News.